grateful you've all taken time out of your busy evening to join. So I think we should launch. Let's go ahead and turn it over to Monica Benjamin, your local awesome provider.
Thank you, Brina. All right, so we have a presentation here put together through the American Academy of Pediatrics Vermont chapter, and we're going to talk about the COVID vaccine in kiddos age 12 and up, which is so exciting, as Brina mentioned, that this was approved yesterday evening, that we get to have this conversation now. So as I screen share here, let me know if I'm ever I don't have a slide that has not caught up with what I'm saying, or if there's any other questions. Brina will also be monitoring the chat during the presentation, and we will have a question and answer session afterwards. So we have done our introductions. We're going to go do a brief overview of where we are at with COVID in children in Vermont currently. A quick reminder about mental health and concerns about our children and adolescents during this pandemic that we're now 14 months long into. Then we have a great video from Dr. Becca Bell about the COVID vaccine and where we're at with everything. And then more information on the COVID vaccine, and then our question and answer session. For these next two slides, I'm going to turn it over to Brina.
Great, thanks everyone. So we just wanted to ground this conversation in the data and the complexity that, COVID is not a pediatric disease. It has not been a significant situation in Vermont as it relates to children, but that doesn't mean there haven't been cases. And so as we have safely opened our childcares and our schools, and we've had a very successful year as Vermonters who work and care for children, we did want to remind everyone that in the 0 to 9 category over the past 14 months, we've had 1,700 cases. And if you look at the 10 to 19, which is the group that almost all are now eligible for vaccines, we're at 3,590 cases. So depending on how your brain works and how you look at graphs, that's currently the second highest age group for cases in our state analysis. So we wanted to start there. And then the next slide, if you could help, yeah, thank you. We did spend a fair amount of time in the Vermont Department of Health looking at the data as it relates to school-age children, because it became very important that we were able to tell a story about the 5 to 18-year-olds, recognizing that some 18-year-olds are out of the public school system and in college. And you can see that we bumped along for quite a while, doing kind of a single-digit amount of cases, and then we got a little uptick as the community spread increased over the holidays. But we really hit a pretty rough patch back there at the beginning of April, and there were a lot of reasons for that. I think from a public health perspective, that was a time when COVID fatigue became quite significant, and people who were parenting young people had to start letting them gather, and there was still a ton of cases in our community. So the uptick was really reflective of kids moving about, a little bit more gathering, and we had to really react and gather together about what to do with schools and cases. And then it's come down nicely, and we continue to have a handful of cases in each community in these 5 to 18-year-olds. And then the next slide shows it even easier to digest, which is, look at that. If you look at the color coding on the bottom, elementary school children 5 to 10 are blue. The middle school kids are sort of a maroon brown, 11 to 13. And then our high school students are represented in a lime green. And back at the beginning of April, we really had peaks in all 3 of those groups. And I'm grateful we've gotten that back on track. But for the purposes of tonight's conversation, it's just important to remember that kids do get COVID. Back to Monica.
Thank you, Brina. So this was shared with permission from a child that was really excited about the vaccine, talking a lot about the fact that there has been a lot of increase in use of all the technology that we have, Zoom, Google Meet, FaceTime, but there's not that true connection, seeing your friends in the hallway, talking in between classes, having the sports games and gatherings and the musical gatherings and every other form of extracurricular activities that kids do. And there's really missing that. And the kids have really suffered. I will say that when this pandemic started, I was really worried about our preschool and younger age kiddos. And then as time marched on, it's really the adolescents, the school-age children and older that have really been kind of forced to take a big step up and change the way living life that they know it. And they are kind of getting sick of it and they're done with it now. And so kids I've talked to this week are really excited about the fact that we now have a vaccine that can give them a little bit more permission to do things being back to normal. So this is a message from Becca Bell. I'm going to stop sharing my screen from a moment and she's going to share hers so we can have the closed captioning video go. Becca, are you still there?
Yes, I'm here.
Okay.
Yes, sorry about that.
That's okay.
Okay, so I'm going to share. Okay.
Hi there, I'm Becca Bell. I'm a pediatrician in Burlington and the current president of the Vermont chapter of the American Academy of Pediatrics. And I'm just going to take a few moments to talk about how excited we are as pediatricians that the COVID-19 vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured. And so vaccines are something that have always been really important to me because they help prevent a lot of the very serious illness I sometimes see in the ICU when children are too young or haven't been vaccinated against a vaccine preventable infection. And when I think back to last spring, when everything was shutting down and I was working with some of my other ICU colleagues who care for adults, and we were really worried about the number of ventilators and the number of hospital beds. If you had told me then a year ago that we would have a number of safe and effective vaccines that in trials, when tested on tens of thousands of people, prevented people from not just dying, but even becoming seriously ill enough to even be in the hospital, I don't know if I would have believed it. It's amazing how effective these vaccines are. And a lot of people are wondering, how are we able to get these vaccines so quickly? It seems like quite a feat. And, you know, in pediatrics, we're used to vaccines taking a little bit longer. And part of that is that there's a lot of competing interests in terms of what type of research and technology gets funded, right? Lots of competing interests there. And when we test vaccines on other types of infections, usually those infections aren't as common, aren't as prevalent. And so it takes a while to get all that data. But with COVID-19, as we all know, the world stopped last spring, just completely stopped. And the biggest priority that everyone had in the world was stopping this virus. And that what that meant really was having safe and effective vaccines. That became the top priority. And so every effort was turned towards that. All this funding was turned towards that. And a ton of collaboration happened in order to make this possible. So I want to talk a little bit about the vaccines that you all qualify for, are eligible for, or will be soon, and that's the messenger RNA vaccine. So that's the Pfizer and Moderna vaccines. So this is a technology that's been in use in cancer therapies, and also scientists have been using it to study vaccines for other infections. And so when the world was told what the SARS-CoV-2 virus looked like, that was something that was shared with everyone, people got to work. And so they used this technology that already existed, and they made it applicable to the SARS-CoV-2 virus. And because there was so much funding going towards this, they were able to make this happen on a little bit of a quicker timeline than usual, but all the steps were there. They went through every single step. And because COVID-19 is so prevalent, when they did the efficacy trials to see if it worked, and they gave vaccine to some people and a placebo to other people, they saw very quickly that the people who received the vaccine weren't getting sick from COVID-19, and the people who didn't receive it were getting sick. And that data was collected so quickly that they were able to get a pretty definitive answer that these vaccines are really effective. And one thing that I think is so interesting about the mRNA vaccine is that it really gives your body instructions for how to make a protein that looks like what's on the virus. So what do I mean by that? So when you get the vaccine, this mRNA is like a little piece of instruction, or I almost think about it like a handwritten recipe that's sort of passed down in your family, right? You have a piece of paper with a recipe, and then these are instructions. And your cells can make, based on the instructions, can make a spike protein with that. Then once it's made, recipe goes away, and the mRNA, it just kind of disintegrates and disappears. And then what you have is this harmless spike protein that's not the virus, but is similar enough that your immune system can look at it, recognize it, and get ready for it in case they ever see the SARS-CoV-2 virus. And this is really important because this is what will stop the virus from replicating throughout your body if you're exposed to SARS-CoV-2 and making you very sick. And one of the things we know in intensive care medicine is that these viruses, SARS-CoV-2 in particular, the virus itself can cause a problem in your body. It can cause direct injury and illness. But the other problem is on the other end, when your immune system is trying to fight off that virus, that battle that happens can create a ton of inflammation and a lot of problems and a lot of illness. So it's that back and forth between it's the virus and your immune system. When you get exposed to the virus, when you get sick, that can make you really sick. Now, in someone who's been vaccinated, instead, their body sees the virus and their immune system's already ready. They already have the antibodies. They recognize it really quickly before the virus can kind of get out of hand. And they've got the cells ready that they know they need to fight off this virus. And that's why people aren't getting very sick. They're not dying. And if anything, they might have a mild cold after being vaccinated. And that is what's so amazing, is that these vaccines give your cells this recipe for how to create this spike protein. Your body then, your immune system then learns it, understands it, recognizes it, and gets ready for it. So when the first authorization happened, first with Pfizer in December, I was one of the lucky ones to get vaccinated pretty early. And as you can imagine, there were lines of doctors and nurses and other healthcare providers who were just so excited to get this vaccine. I mean, it was emotional. I felt emotional getting the vaccine for the first time, knowing that I was protecting my body. And then I got my second shot in January and had the expected, many people kind of feel crummy the next day because they have that, they can sense their immune system sort of recognizing again this spike protein and sort of revving up for it. And then felt fine after a day. And it's just been so amazing seeing my rest of my family and my friends and my colleagues and everyone I love getting vaccinated. My own children are too young right now. They don't qualify, but I am going to be so relieved and so grateful when the vaccines are approved for their age group, and they will be first in line. So I just wanted to spend a moment just to really let everyone know that, we're living in this really, really challenging time. This virus has really wreaked havoc directly and indirectly, and it's affected all of us. But there is this really bright spot, and that is these vaccines they're really effective, and they're really doing what we want them to do, which is to keep us from getting sick. And we really want you to ask questions. If you have questions about the vaccine, we're here for you. Pediatricians are really excited that the people we love, our patients, are going to get vaccinated soon. And we're happy to walk you and your family through this process and work towards getting our communities healthy and getting back to doing all the stuff that we love doing. So thank you so much for listening, and please feel free to reach out to your pediatrician and reach out to us, and we're happy to work with you on this. Take care.
Thank you, Becca. I'm going to share my screen and walk through the rest of the presentation we had prepared. If there's any questions, feel free to type them in the chat box or even unmute yourself for a small enough group that we could probably take a pause and answer any questions. So why should you get your teen get vaccinated, your adolescent vaccinated? This is so exciting, as Becca was mentioning, you know, great reason to get the COVID vaccine. If you have a chance, if you unfortunately have the chance of being exposed to COVID, you don't have to quarantine afterwards. There is more freedom for travel, hanging out with peers and loved ones and just people in general, and getting back out there and having a chance to have life as normal, seeing your friends, socializing, playing your sports if you're on travel teams, you know, crossing state lines and not having to quarantine when you get back. And life will just appear more like normal, which is so great. You know, that's all of us want at this point in time. I'm sure there's a lot of questions. And again, please don't hesitate to ask at any point in time. A COVID vaccine, the Pfizer vaccine was authorized for kiddos 16 and older in December. And the same vaccine was recommended for use in ages 12 to 15 as of yesterday, which is amazing. And I've already had people come into the office today telling me they registered their kids. You know, we have some clinics coming up at schools that we're going to be reviewing in a moment. So how do they work? These are really similar to the other vaccines your kid has received already. As Dr. Bell mentioned, that, you know, the SARS-CoV-2 causes the virus that causes COVID-19. They get inside our body and they multiply and we can get sick. The vaccine stops this by helping the immune system make special proteins called antibodies that fight off the virus. After vaccination, your child has less of a chance of getting COVID. And if they do unfortunately get infected, they may not be as sick as they would without the vaccine. Kind of like the flu vaccine, right? We get the flu vaccine. Even if you get the flu after getting the flu vaccine, it is a much lesser illness than you would have had with not having had the vaccine. So there are 3 different vaccines already given emergency use authorization from the FDA. The Pfizer and Moderna vaccine required 2 doses. The Pfizer vaccine is the only one currently authorized for youth in ages 12 to 17. Moderna is still finishing up their trials, and Johnson & Johnson involves a single shot. The one-shot vaccine was temporarily paused a few weeks ago to look for possible ties to rare serious blood clots that were reported during the vaccine safety monitoring process. This pause ended when the data confirmed that the chance of developing the rare clots with the vaccine is extremely low. And the FDA has determined the available data show that the vaccine's known and potential benefits outweigh its known and potential risks in individuals aged 18 and older. So how effective are these vaccines? The research to date has shown that thus far, all of the COVID vaccines available are highly effective at stopping people from getting COVID-19. They also can help prevent serious illness, hospitalization, and death when those people who are vaccinated get COVID-19. What we don't know is how long this immunity will last. We are still trying to figure that out. You know, all of us getting the vaccines now are kind of part of this data and this research. So as time marches on, we will know more about, you know, do we need boosters? How long is the vaccine going to be effective for? All 3 vaccines are safe and similarly effective at preventing illness and severe death, which is amazing. Because each clinical trial was run a little bit differently, we can't directly compare the effectiveness against each other. And also, these variants that we are seeing now weren't widely circulating when the vaccines were being tested in the early trials. What we do know is that they have been effective so far, which is great. And they all have similar side effects. And the side effects are a normal way that your body builds immunity to COVID-19, side effects being kind of like body aches, maybe a low-grade fever after getting the vaccine. So how do we know that these COVID vaccines are safe for our youth? The COVID vaccines are remarkably safe and effective in adults and youth ages 12 and up. These trials that have been done for the vaccines have involved tens of thousands of volunteers, which is amazing. The vaccines continue to be monitored extremely closely. And in fact, the CDC says that the COVID-19 vaccines will have the most intensive safety monitoring in US history compared to other vaccines. What about side effects? Some people don't have any side effects at all. Common side effects that have been reported for those that are 12 and older include fever, chills, headache, nausea, fatigue, and pain in the muscles, most especially the arm muscle where you get the vaccine. These side effects are temporary and they go away within a couple of days, even within 24 hours after getting the vaccine. So it takes around 2 weeks after getting the second dose of the Pfizer or Moderna vaccine for your body to build up effective immunity to the virus that causes COVID-19. For the one dose Johnson & Johnson, building up immunity takes 2 to 4 weeks. The great thing too is these COVID vaccines are free, whether you have health insurance or not. So there's absolutely no cost to you whatsoever. Clinical trials for our younger kids, 12 to 15, show that the vaccine is safe and effective. We're now scheduling kids, so exciting. And clinical trials have started for kids as young as 6 months old at this point in time. So what about getting COVID vaccine around the other vaccines that we do routinely in childhood and adolescence? Totally fine. It's a great time to make sure everyone else is up to date on all their other routine vaccines. Vaccines can be given the same day as a COVID vaccine or even like within a couple of days, all depending on what vaccines a child might be due for or not. And we always want to make sure when we do our well visits that kids are up to date on vaccines. It's a big thing we check on every year when we see kids, or, in our younger kids, we're seeing them every few months. So you can register at the Health Vermont website. Kinney Drugs is also offering the Pfizer vaccine, as is Walgreens and CVS, which is amazing. We have, and in the next couple of slides, we're going to be going over some school clinics that we're going to be having coming up in the next several weeks. The best way to register for these vaccines at the school clinics is to go again to the Health Vermont website. You can schedule a school at the school clinic, or you can also call to be registered as well. If you as a parent have already registered yourself, you can add your child onto your account, and that's kind of a good way to give consent for that. Some clinics might have like limited walk-in doses. If the student has a parent or guardian with them, they can provide consent at that time. Schools will be given a permission form that parents, guardians can use to provide consent, be translated into multiple language. Over the phone during the clinic, if a student attends a clinic as a walk-in without a parent or guardian, the staff will be able to call the parent or guardian and give consent. And the best way to get a guaranteed vaccine is to register in advance. Breaking news as of this afternoon is that there are 100 doses of vaccine available tomorrow at Middlebury Union Middle School. You can email Kelly Landwehr to register for these vaccine slots, which is really exciting to know right now. Again, this is all Pfizer vaccine that will be given to these kiddos. Here's some great resources. I'm going to kind of leave this slide up at this point in time because it has a lot of links on it, and open it up to any questions or concerns, comments at this point in time.
I have a question.
Yeah.
I have a recently turned 12-year-old, currently 6th grade. And I guess my concern is talking about some of the trials is that, age group 12 to 16 is, you couldn't get more hormones running around in their little bodies. Just massive changes. And that's really, I don't need to be convinced. I'm fully vaccinated myself, both shots. But that's really my concern about the vaccine with this age group, is that have we had enough time to really know how that's affecting them? Because like I say, these are bodies with so much going on, especially, hormonally and in adolescence, that is really my big concern, not whether to do it, but to really look at how it is affecting, the long-term effect of these kids.
Yeah. And, I would say, at this moment in time, we definitely don't have like the longer term data. We have the short term data. And the short-term data says, this is not going to have an effect on their hormone, their hormone development, their pubertal development, their fertility, anything like that.
And how do
Definitely,
how do we know that? I
with-
mean, I know that different medications have different pathways in the body.
Yeah.
How do we know that with this vaccine when we look at, that kind of development, in these kids in terms of fertility, healthy hormone growth, etc.
I'm going to turn this over to either Brina or Becca to like address this in like a little bit more depth than I can go into.
Okay, thank you.
Yeah.
Yeah, hi, Linda. So this is Brina Holmes. I'm a pediatrician as well. I work at the health department. I really loved Becca's video for the description of what's going on with these vaccines. So when you are a messenger RNA vaccine, that pathway of producing the spike protein and the antibody response is really separate and distinct from the body's hormonal system.
Okay.
So I also recognize my background is adolescent health, and I recognize what you're saying in terms of the response of an adolescent to the hormonal changes, but also remember that that's just young people increasing their hormone levels and their pathways to become adults. So they actually don't have more hormones. They're just shifting into the adult level of their hormone
Right.
approach. And then Becca might be able to speak better to this because we talked about this earlier today, but the volume of children in this vaccine trial was actually comparable to all the other numbers of participants that we've had in other trials in the past. It was just compressed and intensive. So it's the right volume in terms of needing tons and tons of kids to go through the vaccine experience to see that there are almost no side effects. And what is remarkable to me as an adolescent physician is that the side effects match the adult profile exactly. So we didn't find anything distinct, despite the fact that we really do know 12 to 15-year-olds act differently on the earth and their bodies are changing. Their
Yeah.
vaccine reaction was the same.
Yeah,
I don't know
which
if
is
Becca wants to unmute. Yeah, go ahead.
I mean, that is interesting. I mean, I don't pretend to have that kind of medical knowledge. I just pay attention. And, given that I am the mom/grandmother of a 12-year-old, this is a big concern to me. And I certainly want her safe, in this COVID ravaged world. I want her safe. But I also want her future safe.
Yeah, I think
The other part I love, oh, go ahead, Becca. Couldn't
Yeah,
see you.
I mean, I think this is a thing that's coming up a lot, and it does come up with other vaccines that we
Yeah.
get, the question comes up, right? So
Yeah.
it's always what do we know about what happens in the future? And I think there are two things that I think about. One is that sort of as Dr. Holmes hinted at, there isn't a real biologic reason why this would affect the hormone. So I think to ground ourselves in the science of like what's actually happening with both the mRNA vaccines and the other types of COVID vaccines, like there's no real biologic pathway in which this would affect hormones.
Mhm.
The other thing that's helpful to think about is that people ask this question with every vaccine that we, basically have ever developed. And we think about some of these other vaccines that we give during adolescence that have been around for a long, 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 long time. And we haven't found any, we haven't found any long-term side effects. So the side effects that we find in vaccines are really the short-term, either, the allergic reactions, this severe allergic reactions or the stuff that happens in the first few days afterwards. So it's a question that comes up all the time. You're not alone in thinking about that and
I wouldn't think so.
doing your due diligence and asking about that, right? That's like what we do as parents and caregivers is to ask about that. But those are the two ways I think about it. One is that there isn't a real biologic reason for it to cause a problem with puberty or hormones or fertility, and that this question has been asked before about other vaccines that are given to this age group, and we haven't seen that.
Right. I think that probably why I was thinking about it is that, I think somewhere in one of your slides it said that this has been the fastest trial in the history of the U.S. And so other trials have been able to go longer to see some of the effects. So the fact that it is a fast trial, which I personally, for everybody that we've lost and everybody now vaccinated, totally happy and totally delighted for. I'm just, as you say, just doing the due diligence, basically on the quickness, of the trials and the vaccine. So, but what you're saying is helping me, and I appreciate that, particularly, when you talk about the fact that it isn't the same pathway. And obviously those hormones have already been at work for quite a while now. So I appreciate that. That helps and begins to answer my question.
Well, that's great, Linda. We really, as pediatricians and pediatric healthcare folks, we really welcome the dialogue. That's what we love about our field. We've been doing this our whole career with all the vaccines, not just COVID.
Right.
Welcoming people in to feel safe to talk about their concerns. And I did want to note, Monica, there are a few questions in the chat. So M-Star is asking, are there pre-existing conditions indicating the vaccine should be avoided?
Yeah, I saw those questions as we were finishing up the conversation with Linda, and I would say that there's no, medically diagnosed pre-existing conditions. What they are saying is if you get your first vaccine, you have allergic reaction, it's contraindicated to get the second. And then if you have a known allergic reaction to any of the vaccine components, then that would also be a contraindication. But in terms of any medically diagnosed pre-existing conditions, there are no indications that would say that that you should not get the COVID vaccine. Everything is saying, yes, please get the COVID vaccine, which is good news. And before, Linda, we kind of finish with did we address all of your questions and concerns? Is there anything else that you had before we get to Katie's question?
No, I mean, I think you did a very good job, and I may have more as people ask other questions. It might, spark some other concerns. And obviously, the bottom line for all of us is the health and safety of our children. And
yes,
so
definitely.
I may be missing a question, but I think these questions on the chat now are very good. So thank you very much for asking me that.
Oh, good. Yeah, anybody, please pop up at any time, either unmute yourself or in the chat box. And Katie, to address your question, I believe the trials included kiddos with various medical conditions. It wasn't just your neurotypical, developmentally normal kiddos in the trials. And Becca or Brina, if you want to speak more to that, I would definitely welcome your input as well.
Yes, I was actually just going to try to pull up to see if we could find more information about the data. That I didn't watch the whole ACIP presentation yesterday. So I think that data is now available to see the breakdown, but I need to actually look that up. But that is a specific both in the trials with adults too. And so remembering too that we're thinking a lot about the trials of the 12 to 15-year-olds, but remembering that there were trials started last year that was 16 years old and up. So there are going to be there's a lot of physiology that's pretty applicable in 16, 17, 18, 19-year-olds are pretty similar to 12, 13, 14. And so those folks have been studied across various medical conditions, and they've also been followed longer, right? Because they all were vaccinated last summer and fall. But Katie, I can look, I'm going to mute myself and then look and see if I can find a breakdown of that to answer your question.
And Maria, I see that you have your hand raised. Do you have a question?
Yeah. Do you anticipate the vaccine being available to children less than 12 years old at some point?
I sure hope so. I mean, the clinical trials are ongoing right now. So that is the goal. They had started the trials with the 12 to 15-year-olds, probably it was around this early to late winter, and now we have it available. And so with the ongoing trials that are being done now in the 6 to 11-year-olds, I would say yes, that it will be available. What it is going to look like, are the doses going to be different than what we are giving everyone now? Unknown, to be determined.
Yeah, this is Brina. I would, well, one of the things I wanted to say that I think you'll find interesting is when you train in pediatrics, it's a very small group of subspecialists across the country. So the folks on the advisory committee on immunization practice, we actually know personally, which is this Paul Offit, who's the head of the committee. That's a pediatric infectious disease doctor, is actually someone I know. So the level of trust that imparts as a local, a Vermont pediatrician, to know the people that are looking at the studies. And so those folks, prognosticate a bit that we're going to be talking about vaccinating kids 6 months and up by the fall, that this is September, and people talk a lot about it in the context of what's the school year going to look like when we come back after the summer, and we'll be moving rapidly toward vaccinating all school age kids. It's really remarkable. And then I see MSTAR's projected date for Moderna. That, interestingly, Moderna is getting close to submitting for approval emergency use authorization for 12 and up. Some people say by the end of May. And that, maybe it's been interesting from an implementation perspective. Moderna is less fussy in terms of the freezer and its handling. So if Moderna is approved for 12 and up, we will find ourselves with even more access for vaccinating those children. I will say, however, I'm sure you're following the data. Vermont is figuring it out beautifully. And I don't have the afternoon data, but by noon today, we already had almost 6,000 12 to 15-year-olds signed up. I know, I could see your face, MSTAR. And the denominator, I don't know if you've heard our governor speak, there's 27,000 Vermonters between age 12 and 15, and we got 6,000 signed up by noon. So that's good math. But I like the way we're doing it, because I think the school clinic should be quite accessible, and I'm really interested to hearing from you all how that works, because I'd like you to feel like it's the minute you are ready and are interested in this for your children, it's just available. So let us know.
And just to reiterate from the chat box too, in case anybody's not following along in that, there was a question about the timing of the vaccines. And initially we had said that when you got a COVID vaccine, no, you shouldn't get any other vaccines within 2 weeks of receiving either one of the doses. That recommendation as of yesterday has also changed, and there is no contraindications to any timing of the vaccine. So you can get COVID vaccine same day as another vaccine. You can get it concurrently with another vaccine if we ever are able to start doing them in our offices, which hopefully at some point, with the Moderna being approved, we might be able to start doing that. And then if, you get a vaccine, say you get your meningitis vaccine one day, you can get your COVID vaccine the next day or 2 days later. There's no waiting period anymore.
Monica, I have a question.
Yeah. Good to see you, by the way, Katie.
Yeah, it's great that you're doing this, because you sort of have an idea of my kiddos.
Yes.
I wanted to sort of ask about the vaccine, and if your child is on, one of my children is on an immunosuppressant and a steroid right now, and that's projected to be about a year-long course for that right now. We just started at the beginning of May. And so what are your suggestions as far as vaccinations and someone who's already sort of immune compromised?
As far as I know, it is okay to receive the COVID vaccine, even given that situation with the immunosuppressed and the steroids. Might have a bit more of what I would call like a reaction afterwards, like might have the fever or might feel a little bit lousy for like longer than like a day or two. But as far as I know, there are no contraindications to what's going on with those medications.
Okay, and then my next question.
I'll just add, Katie,
Sorry.
I would talk to the person who, your either pediatrician or whoever is prescribing the medications, just around if there are, there's, as you can imagine, there are lots and lots of people who've received this vaccine who are on immunosuppressants. And it's more about just making sure the immune system has a good response, right? And so if there's a planned timing where your child might be getting like higher dose stress dose steroids, you might not want to do it right around there. If they're getting, many adults get weekly injections, so they just timed it with their doctor around the timing of when to get it. So I think it might be helpful if there's some nuance to whatever your child's regimen is. Like if the doses of things change or they're getting like weekly or monthly things, then the provider would probably know the best. But lots and lots of people have been getting this vaccine on those medications.
Another question, I have another child who has trisomy 21, and a lot of, I think we're at 22 now, different conditions that have gone along with that. And so my concern is long-term, potentially I know that this hasn't been studied long-term yet, but I worry that she could potentially be a candidate for maybe something long-term popping up. And how, I guess my biggest thing is, how do I knowingly sign her up for something when I don't know what potentially it could do?
Katie, I think that's a really great question and a really good concern. And I think something all of us that have gotten the vaccine so far are like, okay, did we make the right decision? Right in this moment is a really good decision. Long term, I would say we're still figuring out that data. I would say for her, though, the effects of COVID, getting COVID, are probably worse for her given her health conditions than effects from the vaccine and what we know about the vaccine at this point in time. We know that the spike protein that is produced helps us fight off COVID, and it is not affecting other systems at this point in time. Right? It's really just there to say if COVID comes into us, like, we can fight COVID off. In terms of longer term conditions, like, yes, this is definitely, we don't know at this moment in time. What the data we have is like almost 2 years old for like some of or a year and a half old for the vaccines that we have been able to give the trials on. And we aren't seeing, those like, some like weird, all of a sudden developing some autoimmune issue, for example, which is the good news. But yeah, definitely scary to say like, okay, we are still like part of the trials at this point in time, but also really exciting to say we are part of the trials and we are moving forward and we are getting out of this pandemic and getting life back to normal.
Yeah, absolutely.
Oh, I'm sorry.
I'm just going to add a little bit, just because, I do take care of children with trisomy 21 who get viral illnesses, who get really sick from it. And I'm sure that's something that you worry about with your child, because, children with trisomy 21 can get sicker from those viruses. And, I talked about this a little bit in the video, but really what the vaccine is doing, and why for me it's something that I really want all my patients to get, is that it's really like preparing your immune system to be like super controlled about responding to the virus in the future. So one of the things, again, that like what makes people really sick with COVID and other types of infections, it's the virus, but then it's like your immune system is sort of like, what's this? Responds. It's like, okay, I guess I'm going to make some antibodies now. That's going to take a while. I got to make some pull some T cells. I'm like just have this like massive inflammatory response. And that's what can make people really sick. When we think about a lot of the really big morbidities around COVID, it's related to like your immune system kind of being surprised and having to like really fight off this virus. And so when I think about what the vaccine does, is it says like, here's what it's going to look like. The body's like, oh, but it's not the virus, so it can't make you sick. It can't replicate. This is what it looks like. You make the antibodies, you get those cells, all the other cells ready to go. And then in the future, if your child's exposed to the virus, they're already ready. And so you don't have to worry about that big battle. And that's why we're talking about these vaccines, like people are just like not even getting hospitalized, like, right? And this makes sense. The immune system's totally ready for it. And so they can respond right away and in a very controlled way. And in a way that your child doesn't actually have to get COVID to get the benefits of having, immune memory. So I think that like COVID's real, it's out there, and the chances of all of our kids getting exposed in their lifetime is really high. Like we know that it's not going to totally disappear. And so getting their immune system prepared and guiding it so that it's ready to go is really going to make her life, in her future, in terms of being exposed to it, she will like be able to respond in a really controlled way. That's how I sort of think about what's happening in the body when we give the vaccine. And that's why, especially for kids with special health needs, this is like a great, I'm feeling so relieved because I was so happy when adults started getting it because they were the ones that were getting the most sick, but also kids with special health needs. We're doing well in Vermont, but those are kids that were ending up in the ICU in other parts of the country with COVID. And so I'm now feeling more relieved hearing that kids are getting vaccinated.
Thank you.
Is there any indication whether schools in September will require kids to be vaccinated?
Oh, I can address that, Linda, as the public policy person. It's a raging debate.
Oh, I'm sure it is.
It's very interesting. You know, we have multiple mandated vaccines for public education in Vermont as around the country. There are two exceptions. You can have a religious exemption or a medical, which is a rare event. But prior to several years ago, we had a philosophic exemption, which really was a fascinating public policy that ultimately was removed. So Vermont's having a healthy conversation about this already. It has a lot to do with the personal choice part of being a citizen versus the public health. So I watch it and participate in it with great interest. Private colleges, as you know, are rapid fire coming on to required. I think there's 7 colleges in Vermont so far that have stated they will require it for their students in the fall. University of Vermont has not as a public institution. So I think it's all part of the community consciousness that we're building as these vaccines become more and more available. You know, that wouldn't be a fair policy if we had a shortage or if it was the demand exceeded the supply. But we're, as you know from reading the news, the demand is slowing down ever so slightly and the supply is nice and steady. So we're reaching a place now where we have enough every day.
I have a question. I'm sorry if I keep asking questions, but I'm curious. Dosage wise, how can a dosage to an adult, 150 pounds, whatever, be the same? Like, my granddaughter weighs 80 pounds. She's 12 years old. And I'm curious how a dosage can be the same with such weight discrepancies, or weight is not a factor.
So the good news is that weight is not a factor. Our immune system is not linked to our weight whatsoever, which is why, a 6-month-old gets the same doses of flu vaccine as a 90-year-old does. So that's why we're able to give the same doses to everyone. And like I said, the trials are still ongoing in the 6 month to 11-year-olds in terms of like figuring out the perfect doses for them for their immune response.
Okay, thank you.
You're welcome.
I like to think about it that vaccines aren't a treatment, right? It's not like a medication that we give where we have to like weight base it. This is like instructions for your body to recognize and make and respond to. So we think about it a little bit differently than a medication.
Thank you.
Not sure if Maria, is your hand up from before or do you have another question? I'm getting quite good at Zoom hands. Might be from before. Okay, I don't even know how to put the hand up, so I'm impressed it's up.
Are there any questions? I mean, there's the only silly question is the one that's not asked. So please feel free to ask any questions.
I don't have a question, but I just want to say thank you to you guys for putting this on. I really appreciate this forum, and hearing from you personally has been super helpful. So thank you.
Thank you guys. Thank you guys for attending and taking the time this evening. I know it was kind of short notice for this, but we're so grateful that you're here and able to attend. And we are recording this, so we'll be able to share it for anyone else in the community that might have questions as well.
Great.
You guys are in great hands with Monica and your community. I also see Paco is on. I didn't know if any other medical providers in the county wanted to say hello, or the best part of the pediatric community in Middlebury and Addison County is the dialogue. So you're in great hands if you want to continue to have this conversation, because it's, we don't expect that one slide deck is enough to answer all questions, but we had a really good day today, and a lot of our pediatric colleagues, their 12-year-olds were first in line, especially up at the UVM Medical Center, where they had walk-ins up at the fairgrounds. And I hope that feels as affirming to you as it does to me, that if a pediatrician has read all the studies, talked to all the experts, and wants to be the first one to have their 12-year-old in line, that feels pretty good. So it was a good day in Vermont. It's fun to end it with you.
And I will echo what Dr. Bell said earlier. This moment they approve it for kids under the age of 12, I can't wait to get my daughter vaccinated. Well, I guess we'll say thank you, everyone.
Yeah, we'll say thank you. We'll give you back a few minutes and keep the questions coming. Enjoy these resources. They're pretty impressed with the American Academy of Pediatrics. They've got this healthychildren.org, and they update it every day with multiple languages and lots of science and great questions and answers. So enjoy. Thank you all. Thank you, Monica.
Thank you, guys. Thank you, Brina.
Thank you, Becca.
Thank you, Dr. Bell.
Thank you all.
Good job, guys.
And thank you, Patrick, ASL. Great work. There's Paco. Hi, Paco. I love Addison County.
Thank you, Brina. Thank you for fielding those questions as well in the
Oh
chat
my
box.
gosh. Monica, you're terrific.
Oh, well,
I'm going
thank
to
you.
end the meeting, and you really did a beautiful job. It was so fun.
Yeah, happy
First
to do it
of
again.
many. Yep. Great.
All right.
Good night,
Thank you.
everyone.